Leon Edwards delivered a kicking masterclass to defeat Kamaru Usman at UFC 286. And in this video, we're going to talk about the underlying anatomy of all the different kicks he employed. Welcome back, everybody. I'm Dr. Brian Sutterer. And if you're new here and enjoy learning about anatomy and physiology as it relates to sports medicine, then please consider subscribing to help support the channel. Edwards targeted both the structure and the function of Usman's left lead leg. And he did so with three different types of leg kicks. The first kick was this inside leg kick, delivered often at the medial mid portion of Usman's left thigh. And this is a kick that I think of as leading to increased damage to the leg. This is going to be targeted more at just the muscles of the inside of the thigh, something that's going to lead to cumulative bruising and hematoma formation, as opposed to pure function and structure in the leg like we'll talk about next. There were multiple examples of this kick throughout the fight, with all of them typically striking, again, that mid-medial portion on the inside of Usman's left leg. None of these really hit the knee itself. These were again targeted just at that muscle on the inside of the thigh. Looking at our biodigital anatomy tool here, that is really focused on the medial compartment of the thigh. The thigh muscles are divided into three different compartments. The anterior or front compartment has the quadriceps muscles. The posterior compartment is going to have the hamstring muscles, and then the medial compartment is going to have the adductor muscles. These are what we think about when somebody has a groin strain. There's three primary adductor muscles. There's the adductor magnus, brevis, and longus. Starting from superficial, working our way deep, we have longus, then brevis, then magnus. There's not really a main motor nerve in this area. So when we think about low calf kicks, right, we're targeting that peroneal nerve. We're looking for athletes to get that foot drop because that nerve goes numb or that nerve gets damaged. On the inside portion of the thigh where Edwards is delivering one type of kick, there's no primary motor nerve there. There's a branch of the femoral nerve called the saphenous nerve, but the saphenous nerve is responsible for sensation down lower on the leg as opposed to the muscle activation of the groin. So these inside leg kicks are one that I think of as just developing repeated damage, repeated bruising, repeated trauma to the muscles. And every time Usman is stepping forward with that lead leg, those muscles are trying to fire to stabilize the leg and stabilize the joint. When a muscle is trying to fire, but it's full of bleeding and micro tearing, it's going to be painful. So while these inside kicks aren't necessarily targeting the structure or the function of the leg, the increase in the pain could lead to a more compromised state. The next kick attacked more the front of Usman's left leg, and this one was targeted at the structure, meaning the ligaments that help to stabilize the knee and stabilize that joint. This to me is more of just a front kick or maybe an oblique kick, but here Edwards is trying to, instead of kick, push Usman's knee into a forced valgus or kind of medial and hyperextended position. This now is going to be targeting those ligaments. This is going to be targeting the structure, the stability of the joint, rather than just a pure pain question. Now, yes, if these ligaments become injured, that can lead to pain, but this is more targeted at just the structure, the stability of the joint. Whenever a force comes in on the anterior and lateral portion of the knee, it's going to push it inward in a little bit of valgus. We can see Usman's leg is internally rotated, which is going to expose the lateral or outer portion of his knee. So then when a force comes in from Edwards' foot, that's going to bend it a little bit inwards and maybe some hyperextension. What that's going to do is stretch the inside structures of Usman's left knee, potentially injuring things like the MCL. Here's one more, even more extreme example of this, where again, we can see Edwards' left leg comes in, and instead of this time striking directly on the knee, it strikes a little bit higher up on the thigh, but again, pushes forward, putting that valgus stress onto Usman's left knee and targeting more the structure, the ligaments of the knee, rather than just pain with a muscle contusion. The last thing here to target is the function of the leg, and that's going to be like the low calf kicks, targeting that peroneal nerve. The common peroneal nerve is a branch of the sciatic nerve. So we're all typically familiar with the sciatic nerve, a big thick nerve that runs along the back side of the leg. The sciatic nerve branches off to the common peroneal nerve and the tibial nerve. The common peroneal nerve wraps around the outside of the knee, is underneath the skin, pretty unprotected from muscles at the head of the fibula. This is why fighters will kick in this area for these low calf kicks, because they're trying to stun, they're trying to injure that nerve, compromise that nerve so that the muscles that the nerve supplies doesn't work and you get a resultant foot drop or instability in your ankle. These are really a lot about precision, right? Instead of just kicking all over in the leg, you're really trying to be precise with hitting this area, kind of right at the knee, maybe a little bit just above the knee, but typically down lower on the outside portion. One example that was not as effective from Edwards here was this first one, where we can see the kick lands higher up on the thigh. So this high up on the thigh, you're really just hitting muscle, a little bit of the IT band, which isn't going to be particularly that painful, but you're not going to be damaging the nerve as much as if you hit further down on the leg. So Edwards likely is attempting to do one of these low kicks, but delivers it a little bit high to probably avoid the nerve in this specific example. In this next one though, he's much more effective. Now this kick comes in and you can see how it lands much lower, kind of right at the level of the knee, where that common peroneal nerve is going to be branching off of the sciatic nerve, wrapping around the lateral portion of the leg and coming down. So this kick is going to be much more precise at targeting that peroneal nerve, targeting again the function of the leg and the knee rather than just the structure. So whether it was intentional or not, these three different kicks in different locations are targeting not only different anatomic structures, but also different functions within our body. Pain, the function of the knee, and then also the stability of the knee. And the final kick we of course have to talk about are the body kicks. Now in the body kick, what we're trying to do is usually target the liver. The liver is a big organ that sits on the right upper abdominal quadrant, and we've all seen athletes, fighters just collapse and drop to the ground after getting a shot to the liver. When Edwards is delivering this kick here, that's what he's trying to target. He's trying to target the body, and by targeting the body, you target the liver. As this kick comes in, there's all this energy with the kinetic energy of Edwards' foot. When the foot hits Usman's abdomen, that kinetic energy is transferred into Usman's abdomen. Some of it's going to be dissipated at the skin, some of it's going to be absorbed by the rib cage, but then the rest of it goes into the underlying organs. And in this location, the underlying organ that we worry about is the liver. The liver sits right up underneath the diaphragm and is pretty well protected by the rib cage. Whenever a shot comes into the liver, what happens is all this energy gets transferred through the liver into the capsule around the liver, and then you get this surge of autonomic nervous system activity. In particular, something called the vagus nerve. The vagus nerve is one of our cranial nerves, but is important with the parasympathetic nervous system. When a liver shot comes in, you get this huge flow of activation of that vagus nerve, which activates your parasympathetic nervous system, which causes your blood pressure to drop, your heart rate to drop, and you get that just sick, nauseous feeling throughout your stomach. It's something that you can't control. When that nerve process sets in, you can't easily reverse it, which is why we see, number one, it's delayed, and number two, fighters talk about their body just totally shutting down. The precision that it takes to deliver these kicks is, to me, more impressive than just the raw power. It's not that hard for anybody to just throw a kick, but to know where it's going and be precise enough with it to target all these different structures is what makes one mixed martial artist more successful than the other, as was the case tonight with Leon Edwards. That's it for the video, everybody. I hope this was an entertaining little anatomy and physiology lesson. Let me know, as always, any questions or comments down below, and until next time, we'll see you later. Bye.